I'm Jennifer Schneider. I'm Chief Medical Officer at Livongo Health. Pleasure to be back on campus. I did my internal medicine residency at Stanford. I got a master's in health services research before I entered healthcare technology. So delighted to get to come talk a little bit around engagement versus empowerment. As many of you know, 52% of all of us Americans get our health insurance from large self-insured employers, from people we work for, right? Those people that we work for invest in companies like ours, other startups, and then what they're trying to do is get us, their employees, to use those, right? And so they often see measurement of success as engagement. We'll talk a little bit about why engagement versus empowerment. So this is not surprising. I'm sure there's been a lot of talk at the conference so far. So healthcare is a huge market, right? $3.5 trillion, lots going on, regulatory changes, business model revolution, kind of at-risk components versus fee-for-service, new technology. But I really want to focus a little bit on consumer-driven and what consumer-driven means today in today's parlance. So lots of healthcare is shifting to the consumer. What does that mean? It means healthcare is shifting to the individual, right? So we're starting to see that individuals can get care around the clock, 24 hours a day, 7 days a week. They can do monitoring at home. There's transparency, you know, the likes of a Castlight Health, where there's cost transparency, quality transparency. Individuals are starting to understand more about healthcare. Data availability, right? Still not where we want to be, right? But increasing, right? So we are increasingly able to access our data and do that immediately. And then kind of the big bulk here is that all of us as consumers or individuals are more and more on the hook for the cost of it, right? Healthcare is bankrupting our country, and large self-insured employers are saying, hey, if I give you the money, maybe you can help us figure out a way to make it a little bit more sustainable. So engagement versus empowerment. So I have type 1 diabetes that solidly counts as a chronic condition, right? I'm 41. I was diagnosed when I was 12. When I was 12, I was with the diagnosis. I was not also given 2 extra hours a day to take care of the condition. I still was expected to do everything else everybody else was. You know, still had to shoot the same number of free throws in the basketball court. Still had to take the same math tests, right? So I didn't get more time in my day. So when we think about people with chronic conditions, right, it's really not about, I don't want to spend more time on my diabetes. I just kind of want to make it better and have the whole system work more easily for me. So this idea about engaging people, that if only people had tools that they would use them, is really kind of a false premise. It's really about allowing people to get better with doing as little as possible. Okay, so consumer, right? That puts us in sort of technology has revolutionized almost every other industry. And there's a ton that is healthcare professionals, patients, people who care about healthcare, people who get a paycheck from somewhere in the healthcare industry, right, that we can learn from consumer business, right? So think about Netflix, right? Totally reduced hassles, right? First, you didn't have to go to the crappy DVD store down the street. They would send them to your house. Now you don't even have to do that, right? You can get it streamed. You can be on a business trip and get it downloaded in your hotel room. Uber on demand, right? Like talk about putting you in control and like again, being able to kind of get what you want when you want it. Amazon's brilliant, right? They're brilliant for a whole host of reasons, but I think it's great because when I log on, it tells me what they think I need, right? How cool is that? They can tell me that they think that my son's, what he wants for his birthday based off of all the purchases that I've already had. So this idea of using information to predict. iTunes, right? iTunes is great because they didn't invent anything at all, right? They just took what was out there and they put it together in a system, right? So they really connected the entire system. Google, obviously, the brilliance there is information's available. We can all be experts now. So again, using these concepts and thinking about healthcare, Waze I think is great because it went beyond just connecting an ecosystem, really into connecting a broader network, right? So how do you have success with healthcare consumers? There's really four principles. Make it personal, right? You log in and it has your name, it has context, it means something. Simple, let's not make it complicated. Deliver what people want to hear. Deliver it in short sentences with as few words as possible. make it really context aware. By that I mean, it's not the same for everybody. Having a low blood glucose when you're running a race is very different than having a low blood glucose when you've been fasting for Ramadan, right? What's the context surrounding the incident that we're talking about? And then make it actionable, right? There's nothing that's more frustrating to hear news and then be able to do nothing about it, right? So really connecting those 4 principles to engage healthcare consumers. So the flip is what not to do. Don't build things that consumers hate, period. If it's gonna bug you, don't make it. Don't go that direction. Portals, who remembers what their passwords are? How many times do you wanna log into another portal? Chronic disease call campaigns, these are great, right? I have so pregnancy probably doesn't really constitute a chronic condition, but a short-term chronic condition of 9 months. Healthcare payer plans, I have 3 children. I had my 2nd child delivered, my 3rd is 2 years before. I'm not yet pregnant with my 3rd, and I'm still getting calls from Blue Cross Blue Shield of California about my 2nd child that they assumed was in utero during dinner, right? How horrible is that? Not a great experience. Inbound scheduling, right? Like, that's not very simple. That's not really great to be able to call and sort of have to do the hassle of scheduling. So flip it in healthcare the same way that we have in every other industry, right? Make the information mobile, make it accessible all the time, right? So you don't have to wait to go to your doctor's office. So you can call at 2 in the morning when you break your foot or you have a gash in your leg and you're trying to decide, does it need stitches or not? Make it real time. So this idea of taking the information we have and reaching people when they actually care about it. So an example here is, did anyone here drive to this conference today? Okay, so if you drove to the conference today and your phone were to ring right now and it was, Billy Joe's tire replacement, you'd probably be a little bit annoyed, right? You'd be, I'm really engaged in this great conversation. Why are you calling me? Who gave you my number? However, if you had had a flat tire on your way to the conference and Billy Joe called you in the middle of the conference, you would think that that was magic, right? Talk about the timing. This concept of technology deployed perfectly is indistinguishable from magic. So really trying to get the timing of the perfect outreach. And then scheduling. So allow people to schedule. In fact, encourage individuals to schedule before they even think they need to. Similar to what Amazon's doing, they're telling me what they think I'm going to need in a month or so. We can start to think about ways to do that for people in the healthcare system. So this is really the big premise of the talk here, is that people do not want to be engaged in their healthcare. They want to do less. They want to do less. How can we do that? Doing less allows people to be empowered, not engaged. People don't want to spend more time. They want to be empowered to do it. Better outcomes with less input, if you will. So the world is changing. Chronic conditions are on the rise, and they're on the rise in really disturbing ways. So a statistic that really resonates with me is that in the next 10 years, there will be more people in China with type 2 diabetes than there is in the United States population. These are here, chronic conditions are here, they're not going away. And a lot of those chronic conditions are frankly driven by what? They're driven by exercise, they're driven by city planning, they're driven by increasing wealth, they're driven by access to food, they're driven by moving away from the way in which we used to exist. So a lot of chronic conditions is happening within society, and it's across the board: diabetes, hypertension, hyperlipidemia, depression. I'm going to spend a little bit of time talking about diabetes, and I'm using this as an example, both because this is the company where I work, Livongo, but also because what we're trying to do within the diabetes space is really engage people as consumers, and you'll get to see some examples of how we're doing that through the technology space. So today, 29 million people in the US currently have diabetes. 1 in 3 in the US in 2050. 1 in 3, 33.3% of the population, huge issue. Incredibly costly, $245 billion in the US alone. And important, people with chronic conditions miss a lot of other opportunities. Those of us with chronic conditions, we don't show up at work as much. When we do show up at work, we're not as productive. So a lot of costs to the system, not just in terms of our condition, but also in productivity, absenteeism. So in the world of diabetes, I don't know if many of you are familiar with the ecosystem. There's a lot of changes, but they're still pretty inadequate. So people with diabetes, the biggest thing is they run out of strips. They're told to go check, we are told to go check our blood glucose, and then our insurance company says, that's awesome. But your doc says you need 45, but we're only gonna give you 30. And oh, by the way, those 30, they're gonna cost money, and when you run out, we're not gonna refill that for you, right? Pretty hard to manage a chronic condition when what the information you're getting from your doctor is not consistent with the benefits that you actually experience on a day-to-day basis. Meters have historically not been connected, which means that I check my blood glucose and I have to write it down in a piece of paper and then go see my doctor in 4 months' time. Then they will ask me, hey, what happened 4 months ago when for 2 days you had a blood glucose over 450? I can't remember what happened 2 days ago, right? What did I eat, let alone 2 months ago? So this idea of data capture being really important. And then the last is healthcare providers. Healthcare providers are overwhelmed and overworked. Lots of information, lots of patients coming through, lots of data to have to sift and sort through. So at Livongo, what we're doing is really revolutionizing the diabetes experience from end to end. And where it starts is sort of the center is a data capture of a cloud, right? So we're able to instantaneously upload blood glucose values into our cloud. And we do that not through Bluetooth or Wi-Fi, because it turns out when those things break, we never fix them, right? We do it through a cellular connection. So same way your phone works, cellular enabled, so we capture the data. We take that data and we run some analytics on it, and instantaneously back through your meter, we give you a personalized recommendation. So think about a marketer's dream, right? There's 3 seconds between when you prick your finger to put your blood in the strip, that your eyes go nowhere, because if you miss the reading, right, you kind of miss the point. So you're looking at the screen. So we have the ability to drive information directly back to the individual. And then importantly, I think in healthcare technology, I fundamentally believe that technology will get us a very long way, but it won't get us across the finish line. That health is different than other industries, and that there's a personal component that's needed. Not all the time, can't be all the time, but it's needed at just the right moment for just the right person when it's most important. So for us, within our company, we have certified diabetes educators that are on staff 24 hours a day, 7 days a week, 365 days out of the year. So when a member checks their blood glucose and they're either really low or really high, they're really in danger, they get a call. They get a call within 3 minutes. The OnStar for diabetes, if you will, really identifying when people with chronic conditions need a little extra help or need a little extra support from the human touch. So what are the outcomes? So Livongo has been very successful, both in improving clinical results and frankly, in saving money, which is really what people who are at the end of the day on the rope for covering healthcare costs are really interested in. So we've been able in our system to improve hemoglobin A1C from 8 down to 7, 7.1, and then sustained out to 7. In diabetes, there is significant comorbidity improvements if A1C is reduced. So death goes down, microvascular complications, eyes, kidneys, nerves, heart attacks, the macrovascular. So really a great indicator of overall improvement, both in diabetes, but also in the comorbidities that are frequently accompany diabetes. And then members love us, right? So this is really central to what we're doing, and I think should be central to any new idea, new platform, new system in chronic condition or acute. People have to love you. They have to love you to continue to use you to drive outcomes. So this idea of designing for the people, really trying to understand and map out what the pain points are that you're trying to solve for is really, I think, the key to success up front as we start to evolve and start to design within the chronic condition space. And with that, I would love to take some time to entertain questions, if there's questions or comments or smart remarks from anybody in the audience. Yeah. Yes, a great question. So Livongo was the blood glucose meter that we have was FDA cleared in 2014. So from a history of our business standpoint, we closed Series C a couple of months ago, and we have over 170 large self-insured employer customers. And we'll have active users, greater than 40,000 active users by the end of the year. So huge and huge growth. Frankly, I was on the founding team of Castlight, and that was a really interesting business that took off fast. And this is much faster, which I think speaks to the need of chronic conditions in this space right now. Yeah, I think it's a combination of all of the above. I'll tell you, if you look, so I think first and foremost, when people know that someone else is watching, we're more accountable. And so this idea that if you give somebody a scale and you tell them to get on it every day, they lose weight or maintain their weight. I think this idea that somebody's watching what your blood glucose is part of it, right? So I think that that's great. I think that the accountability with the relationship between the coach is huge. So our members, they receive text-based messaging, but they have also the ability to interact FaceTime with the coach, and so they establish that relationship. So I think it's a little bit of everything. And as you think about the world of chronic conditions, it isn't rocket science. The medicine isn't rocket science after a while. It's how do you maintain motivation? It's the same as exercise, right? How many of us pay a personal trainer to tell us to lift the weight or go for a run? Well, it's not rocket science to lift the weight or go for the run. The hard part is actually motivating yourself to do that. And I think that's a large component, both through the technology motivation, which includes social, getting to share that information, and community, and then the coach. You can, the way we've set it up is we put the member at the driver's seat, and so they can share that with whomever they want, and they can share whatever aspect they want. So for example, my husband gets my blood glucose alerts, but he doesn't get them until they're really severe. I don't want him getting them all the time. But my mom doesn't get it, but my doctor gets it. So I can pick and choose not only who, but what information they get. And that sharing with the broader community is really critical, because that's the community of caregivers, right? It's not typically the doc that you see for 30 minutes in a year. It's really the people that you're living with. It's a great question. We have not, we don't today, and the reason we don't has been really member-driven, member feedback, right? So it's to say, so the same way that we have alerts, right? If you go really low or go really high, the certified diabetes educator will call you, but we preset it, but we let you change that, because what we understand is not everybody wants an alert at the same time, right? The same for not everybody wants the emergency room, the ER called or the ambulance called at any given number. So we've tested that a lot with members. Members don't want it. Right? And again, this is going back to design from a provider like myself, like what's optimal versus designing for the end user and what they actually really want. So right now, great question. Unfortunately, right now we don't have a direct-to-consumer offering. It's something that we've been thinking a lot about. We've been really, frankly, growing so fast in the large self-insured employer and the payer space that that's where the bulk of our business has been. But it's not too far off. I mean, we have had the ability when people leave their employer to stay with it, but we're not advertising direct-to-consumer quite yet, just from an operations standpoint. Well, thank you so much for the time to talk. I'm happy to entertain questions elsewhere. Thank you.